Okay, everyone, thank you for being here. We're just gonna go get started. Ballroom H was pretty hard to find, so I really appreciate you guys coming out. This lecture is titled Know Your Place, the Importance of Community Health Needs Assessments to the Emergency Medicine Provider. A little bit of intros. So my name is Peter Yoon. I'm one of the third-year residents at UT Southwestern, or Parkland. I'm now one of the new academic chiefs. And right next to me, we have my close friend and mentor, Dr. Ohuabunwa, who helped make this presentation possible. He is absolutely fantastic, and he's well known for his DEI advocacy, specifically activism and work focused on name-based microaggressions. If you guys haven't read his piece, Say Our Names, We Are Doctors Too, it is absolutely powerful and fantastic. Please take a read. He's one of our newest UT Southwestern Parkland Health Equity Scholars, and he's been using community health needs assessments to problem solve and create innovative solutions in regard to healthcare access and equity in our local Dallas community. As for me, I've been really interested in social determinants of health since undergrad. I was introduced to asset-based community development and community health needs assessments through the work with my MPH. I also did the Albert Schweitzer Fellowship, and I did the Lowenstern Fellowship, which was more work abroad, and that really kind of drove my passion for what I'm going to be talking about today. I'm actively interested in pursuing better avenues to provide equitable care for our patients. And I'm really interested in social EM and health equity, so if any of you guys are also interested along those lines, I'd love to speak with you. So with that out of the way, we can go ahead and talk about community health needs assessments. So by the end of this presentation, I really hope to kind of sell community health needs assessments to you guys and talk about the importance of how easy it is and how accessible it is. I really hope to convince you that it's accessible and comprehensive document that any ED provider can easily just go through and use to help give well-informed patient-centered care. And depending on kind of your passions and what you're interested in, you can use that as a stepping stone to further guide your care if you're interested in more health equity work. So because we're in Austin and we've been walking outside, exploring the city, I wanted to specifically walk through the Austin Community Health Needs Assessment. What you see here on the screen is the 2022 Community Health Needs Assessment and also the table of contents. For those who might not know, a Community Health Needs Assessment or a CHNA or a CHA, however it's regarded, is a general state, tribal, local, and territorial health assessment put together by your local policy or your local government, identifying key needs and issues through systematic, comprehensive data collection and analysis. So what's been fantastic about these CHNAs is that they are an easy wealth of information and a product of multiple organizations finally coming together and understanding and acknowledging the importance of social determinants of health. The CHNA covers so many topics, a bunch listed here by the framework from the World Health Organization, from education, the built environment, housing, race, health insurance, life expectancy based on zip code, morbidity and mortality statistics. It's all there. And it's just really fun to read and nerd out with to get to know your city a lot better. And these are easily accessible, and you guys can all find them for your local city. The reason being is through Medicare and Medicare, through the Affordable Care Act, nonprofit hospitals and organizations are required to put this together. So every 3 years, your local CHNA is published and is supposed to be accessible, and you can literally just Google CHNA, and that should come up for you guys, and you can just read it. The Austin CHNA in particular was pretty comprehensive. San Francisco tends to do a little bit shorter ones, but the information, and you have to search a little bit more for the information, but Austin itself was 190 pages, and it was really fun. I'll show you a little bit more about the type of information that's presented in Austin-specific CHNA, and then you can get a better idea. There are a bunch of census graphs, and you can learn so much. I love the life expectancy by zip code. I think it tells you so much. If you are able to say that you're coming into Austin and you want to work, find your hospital, see where you're at, and you already know your patient population, and you can start figuring out how you want to be that ED provider for your patient population. You can immediately learn more about your city. This is Austin's causes of death, crude rate, not very different from the rest of the United States, but maybe where you're going, if you practice in Hawaii, it might look very different. We have homelessness statistics, which is also very important. A lot of us have been walking around the street. I'm sure you've seen kind of what's going on in Austin. And another passion of mine and something that's exciting for me is there's a lot of qualitative data. I think a lot of medicine, qualitative data and mixed research is really hard to do, but the CHNA really works with community leaders and provides quotes and kind of real life experience and kind of adds that to this lived experience in the city. So now that we know a little bit more about the CHNA, I wanted to kind of walk us through a little case and example. Let's say that this is y'all. You are here in Austin, you're excited. I'm like, I'm in this new city, Austin's fantastic, and I want to practice. Everyone keeps saying, oh, keep Austin weird. You know, you're new to Austin, you're not really sure why people keep saying that, but the city seems nice, it's a little hot, you're walking around. And after you start going, practicing, seeing your patients, you start noticing some trends and you become curious. You start questioning the homelessness in the city. You're worried about rates of obesity. You're seeing uncontrolled diabetes, which we see a lot in the emergency department because we are often primary care providers. So being the great physician you are, having attended this presentation, you go to your CHNA and you start doing some groundwork. You start learning about more specific problems Austin has. So this is a quote about kind of the gentrification and things that are happening in the city, especially with our rural communities in Austin. So here I highlighted some of the main points: to be intentional about planning in our rural community that are not in Austin proper, right? A lot of stuff that's going on is Austin is booming and a lot of people are being moved out of their homes, and that's gonna affect the types of patients that you end up seeing if you're in Austin. One thing that I found, I'm also really like food insecurity and kind of looking into that, and I think this says a lot, especially in the community that we're in. The neighborhood is built for yuppies and is catered toward the tech-savvy group. They brought scooters, and I can't get on a scooter. The scooters are everywhere, right? They're trying to build another beer garden, and that's not what I need. We need a ma and pop store. The Whole Foods is too expensive, so residents can't cook a healthy meal. You start looking at, where your hospital is at again, and you see where low income and low access is, and you can further characterize kind of what's going on in that city. And then specifically in terms of diabetes, you can find that information, and you see that, Austin diabetes rate isn't that much higher. Maybe it's just the patients that you've been seeing in your local area. So with all of that together, I kind of wanted to present this case here. So let's say the next day you see this young woman who comes in the ED in the middle of the night complaining of flu-like symptoms. She's a 40-year-old woman with type 2 diabetes on insulin, but with no other comorbidities that she knows of. You get basic labs, there's only abnormalities, her blood glucose is 400, and we see that all the time. She is asymptomatic, and you go to talk to her about her blood sugar. She's really worried. Knowing kind of now what's available in the CHNA and kind of the information that I provided to you guys, I wanted to kind of open it up to y'all. What kind of questions would you ask, or how does this change your framework or mindset in terms of approaching this patient now that you're in Austin? And then if we can get the mic.
I think one of the important questions is asking her, how easy is it for you to get refills on your medications? How often do you get people who are just like, oh, well, I don't see a doctor, so I can't get it prescribed to me. And so although med refill visits can sometimes be frustrating, it's also the only way for some people. So I think that's an important question.
Yeah. Anyone else?
So another thing to consider is that she might be in a part of the city where she can't afford healthy meals. She might be in that situation where she can't go to the Whole Foods. She's not having great access to the other things she needs to maintain a healthy lifestyle.
Great, yeah, so a lot of this stuff, unless there's anyone else.
Well, I was going to say something similar. Prevention is like probably 4 times as powerful as anything we do in curative medicine. So yes, getting access to medicines is important, but also what my colleague just said, trying to make sure you can do those other things, like does she smoke? Does she need help to stop smoking? Mm-hmm. This is a risk factor she's going to face going forward. Does she have, as was mentioned, access to good food? Does she have, maybe her job situation or her livelihood is such that she's she's single mother doing 2 jobs. Does she have time even? Does she have enough opportunity to do anything but go and buy fast food, which is probably the worst thing for her health. So those kinds of considerations.
Fantastic. I think when it comes to specifically our work in the emergency department, and depending on you and what you are looking for in your career and how you want to help patients, how you use the CHNA can really differ. So say that you actually want to do stuff outside and you want to work with community organizations, then you can work more on that prevention aspect. I know a lot of, we're at UT Southwestern, we're blessed to have 24-hour social work, so a lot of times setting up that care isn't necessarily the biggest thing that I'm thinking about when I'm running around trying to help other patients. But one thing to consider is if you read the CHNA, you try to get a better part of know your city a little bit better and know the local area, and you can ask this patient, hey, where do you live, and know what that actually means versus just saying, hey, I'm gonna discharge you, go to this pharmacy. Right? When I was a medical student in Houston, having lived there for a long period of time, if someone said they were from Edo or from Montrose, or I'm like, in the 3rd Ward, I knew exactly what those places look like. I have visited them, the built environment, I understood. I had done some survey research. I saw the sidewalks, the garbage in certain areas, right? And so you get a better understanding about how to even empathize with your patients, right? If that's something that you don't necessarily want to do all that outside work, even that empathy is something that you can gain from this CHNA alone. And I think that's something that I definitely want to share with you guys. Other aspects are just, again, like we were talking about earlier, is insulin or even food planning, and how do you want to get involved with that, or what kind of discussions do you want to have? And if you feel passionate about it enough, how can you start programs in order to help with that? And the CHNA is just a small example and a stepping stone that I believe can really help guide you guys in terms of that passion, if that's something that you like. So kind of going off of that, right? So there's so many levels of intervention that can happen when it comes to health equity. And so we look at clinical interventions, which is a lot of what we're doing in the emergency department, but there's prevention we were talking about earlier. And so using that CHNA, determining where you want to have that big impact, I think is very important. When you go through, you can get a good idea and understanding of what type of issues are going on. Again, it's 190 pages, so you can, they had a specific COVID section, emergency preparedness section. They had not just diabetes, but homelessness. They had rates of HIV/AIDS, and you can get an initial sense of where you want, and then to learn more about the city and decide how you want to get involved. I think it's a very easy way for that all to happen. Any questions so far? So whether it be more downstream, kind of what we were talking about with direct patient care, if you want to just make sure that you know your city, be that local emergency doctor who understands your patient population, start with the CHNA. Whether you are, I want to be more big picture, I want to get involved in local organizations, the CHNA and all the organizations that work together to write and publish this are all listed, their contacts, their leaders are all there. You can start there also, right? If you want to go even beyond that, go with your local department, your public health organization. The Austin Public Health Organization helped put this together too. So again, a great stepping stone for any emergency medicine doctor to get involved.
Another thing is, for those people who are as interested in, going through the whole CHNA, there's an executive summary. So start there, and at least it gives you a general idea of what things are going, and you can just go through, some of the pictures because it gives some graphics. So for example, I'm interested in diabetes care. So, you can go through and just focus on the diabetes area and be able to understand what's going on, but the executive summary kind of gives you an overall picture. Secondly, the CHNA comes out first, and then a few months later, they usually have an implementation plan. in terms of interventions that are required based on CHNA, because it's cool and all to have like the information, but the second step is what are we doing to tackle that? And if it's something that's more interesting to one, it's like now that the emergency department, we're now focused on, there's some areas of social emergency medicine and like focused on like not just the patients that come into the ED, but what can we do in order to prevent revisits and things like that. It becomes important to be able to see what your organization is doing in that aspect and what are things that you can do in order to like jump in on, especially in terms of the priorities of the institution.
Yeah. The summary is great. I love it so much, I just end up reading the whole thing. But definitely start with the summary, and you can figure out how you want to get involved. Another thing for if there's residents or involved in different programs, one thing that I started doing was we kind of briefly cover the Parkland CHNA at UT Southwestern for our incoming interns to give a better idea of the type of patients that they'll be seeing and get a better understanding of the issues that are going on. It's super easy to put together, and then you give them a little link, and if they're interested, that's something that they can do more of. And I think that's a very easy way for anyone to put that social EM piece if that's something that your program is getting more interested in and developing. So hopefully with this brief presentation, I convinced you guys that CHNAs are really easily accessible. You can Google it right now. I dare all of you. You can find it. Type in any city. You will find it. Maybe the third link, potentially, but it's there. And it's actually, with the executive summary, very easy to read. It's very comprehensive, and depending on how you read it, it's an easy stepping stone for you guys to get involved in more health equity and interventions for upstream healthcare. Cool. Thank you, guys, and I will take any questions.
Hey, sorry. Fantastic presentation. Thank you guys so much. I'm a fourth year at Wake. This is so cool that the CHNA seems like such a useful tool. Are you guys aware of any, to your point, what are our next steps from here? Are you aware of the CHNA being implemented in any EDs to help improve primary care follow-up?
I don't think it's standard practice, but it's something that becomes an area of research and an area of action. And this is why we're trying to bring this up to people. I feel like one of the other steps, like I've been now working with the Center for Innovation, and one of the things they're doing is like incorporating the CHNA, not just for like zip codes, but like now going down to the granular level of the block level and looking at what are the things that people in this area, because sometimes zip codes, you guys have known this, where you drive in a neighborhood and one area looks like there's $2 billion houses, and then next door is like a $20,000 house. And so going by just zip codes might not be the granular detail that's needed. And so that's one of the things that's been worked on now, is like bringing things down to the block level and updating these resources, which can be helpful in terms of more targeted care for patients.
In terms of more health equity work, I know there's plenty of people who are doing working with local organizations kind of through community-based participatory research, right? That's basically what the CHNA is, and it's a summary document kind of putting that all together. And so I'm sure you can meet plenty of people who are doing work either kind of associated within the ED or outside. A lot of times, what's hard about health equity research and kind of social EM and all this stuff is there's so much overlap with different groups. So family medicine is doing IM, right? I know at UT Southwestern, there's a lot of card stuff going on, and they definitely do community-based participatory research, but it doesn't necessarily mean it falls into ED. But I think that's our job, is how do we think about and ask the right questions to say, where does the ED fall into this, and where do I, as an emergency medicine physician, fall into this, and what kind of question and solutions do I want to come up with? I think that's the really hard part, and I'm still figuring that out too. Yes.
So Tareen from University of Colorado. This is great. There's definitely some variation. It's interesting. I mean, I didn't realize some of the community health assessments have qualitative data, which is so powerful. So I really appreciate the examples you provided. My question is specifically about the implementation plan that you mentioned that also shows up or is developed several months subsequently. I haven't seen that at all sites, and I'm curious as to what that entails and if you have any examples of ED-based interventions potentially that emerged from that.
From I was just looking at the Austin one. I think they have a cycle. So it's like they come together, they publish, and it depends on each city. They come together and publish, and the last time I saw on the public health website is there is some implementation. There's like apparently a document that's gonna come out where they're gonna discuss that. I don't really know. I was mostly focusing kind of on the Austin stuff here for this presentation. I don't know if...
Yeah, I can speak on, I'm a little biased because, I'm in Dallas. So for the Dallas one, they break things down into like the healthcare priorities. I have it up right here. I wish I could. But like health concerns, maternal and child health, community equity, and public health practice. And then they make like a little diagram that goes through what has been done before. So I'm just looking at the 2022 because they do it every 3 years, right? And it was interesting because they made the one for 2019, and then guess what happened? COVID happened and like messed things up. So they're like, okay, now that things have been messed up, now let's like recalibrate. These were the things we planned to do from the public health practice standpoint, from the collective impact standpoint, from the cultural competency. And I feel like sometimes, so like right now I'm on a few of these institutional like working groups or whatever, right? And it's like, sometimes I feel like the ED is kind of like that, oh, what? So you guys do this? And it's like kind of interesting. Like, sometimes they don't know that the ED OBS exists. And I'm like, oh, did you guys think about the OBS? They're like, oh, yeah. And so it becomes important to join these things because then you can bring that important perspective that has been missing because in the past, we weren't as focused on these, on like the social stuff outside of the ED. And now that there's like renewed interest, it becomes important and a call to action for all of us to be involved in these things.
I think a lot of times with these types of stuff, it's reaching out to those people and those organizations and kind of seeing how you can partner. Again, a lot of health equity work, I feel like, is just emailing people and asking if this is a need and then doing a really good needs assessment even before you do anything. And meeting with like every person who has any stake in that, in whatever they're interested in, because then you're just going to overlap and it might not even be necessary. And so even with needs assessments and implementation plans, if you're an ED provider who's interested in a specific question, you can see what's already been done. And so that's also very important.
Thank you. Jen Newberry, Stanford. So this is kind of a similar question. I was wondering if you know of any, or maybe you've had somebody, you yourself have had success getting at the most upstream part, which is, with respect to the needs assessment, which is the priority setting, right? Like I just took a look at our group. It's like 6 people, super tiny. Like interesting choice. I'm wondering how people kind of got there. It's not one of the hospital committees that's advertised. I'm wondering what that selection process is like. And I just don't know if you've had any success advocating to be right there at the top of the priority setting based off of what we see in the health needs assessment.
So answer to number 1 is I have not, because I'm just getting into this stuff. But I think one of the big things is you see who are the people who are making these decisions, right? And part of it is just showing that interest and saying, hey, I want to be involved in this stuff and why your perspective is important to that kind of situation, and then it becomes easier for them to put you in that group during the next phases. But I think like these people are not running out of, it's like they need people to be involved. It's not, if you jump in and say, I want to do this, no one's gonna be like, no, sit down. They're gonna be like, yes, please. Come on down, take as much. And you'll be like, okay, this is a little too much. Okay, so, yeah.
Anyone else? If not, thank you guys so much for coming. Really appreciate it.